Welcome to the Path to Parenthood. My name's Sophie Hasty and I'm the Parent Education Midwife at Warwick Hospital. The Path to Parenthood is a course of group sessions designed for first-time parents. The goals of the course are to help you prepare for your pregnancy, the birth of your baby and becoming parents, also for the physical and emotional challenges that go with becoming parents and being pregnant. We also hope that you will make friends with the group, and unfortunately because of COVID-19 and this cancellation, that's going to be much more difficult and we're really sorry about that. But we hope very much to get the course going again soon so that you will only miss one session. The situation, guidance and information around COVID-19 is changing all the time. Please check out the Maternity Updates Swift page on Facebook for the latest information and guidance and policies from Swift. There are 4 classes during your pregnancy. This one, which is the 16-week class, is preparation for pregnancy. At 24 weeks, we do preparation for labour and birth. At 32 weeks, preparation for parenthood, that's feeding and living with your baby. And at 36 weeks, we do a bit of a party or a celebration of coming to the end of pregnancy. It's a bit like a baby shower, if you like. And then after the group has all had their babies, so the timing of that is a little bit more vague, so 3 to 5 weeks after the birth of your baby, we get you all back together as a group for a little bit of a reunion and meeting each other's babies and talking about life with your baby. During this session, preparation for pregnancy, we talk about the care that we offer at Warwick Hospital, staying well physically and emotionally, support in pregnancy, connecting with your baby, building a group and relaxation. The next few slides introduce the teams of midwives. So we have the Amethyst team, which covers Wellesbourne, Kyneton, Harbury, Fenny Compton and Southam. Topaz, which covers North Leamington and Kenilworth. Emerald, which covers South Leamington. Diamond, which covers Warwick. Ruby covers Stratford, Shipston, Ulster, Bidford and Henley. So let's have a look at the type of care that we offer at Warwick Hospital. So we'll look at team care and continuity, midwifery-led care and the named midwife, and consultant-led care, and have a think about what all those things mean. Team care and continuity. Each midwife cares for a group of women, all due within 10 to 14 days of each other. So she's allocated to look after those women for a particular part of the month, maybe the first 10 days of the month, for example, and she's the named midwife for that group. We call those groups cohorts. The cohort is invited to the Path to Parenthood class at the same time, so you'll meet the same people at each session. The Path to Parenthood sessions run at the same time as your named midwife's clinic, so you just pop out of the session for a short time and go to your appointment and then come back again. The women that have been to these sessions, or the couples that have been to these sessions, really like it because it means you only need to come to the Children's Centre once for both your class and your clinic appointment. Hopefully, each session is run by a different midwife from the team, so you get to meet all the midwives in the team by the end of your pregnancy. And then when you give birth and you go into labour, hopefully one of those midwives will be available to look after you. And that means that you've met the midwife that looks after you when you give birth, and we call this continuity of care. Midwifery-led care. Midwifery-led care is care that is suitable for women who are having what we call low-risk pregnancies. and that is women who've got no medical problems, are fit and healthy, and there's no anticipated risk for their pregnancy. When you met the midwife at your first appointment, the long one, do you remember that one? One of the things that she was doing then was assessing your level of risk and deciding which sort of care you needed. For this kind of pregnancy, all care can be provided by the community midwife, except for your scans, which have to be at the hospital. So that's all your care through pregnancy, all your clinic appointments, care through labour and birth, and all your after-birth care as well. We're fully trained to do this and recognise problems in the very early stages of their development, so that if those start to arise and we have any concerns, then we would refer you to see one of the doctors. The doctors run their clinics at the hospital. So consultant-led care is for women who have maybe have medical problems, such as diabetes or high blood pressure, or are deemed to be at high risk for another reason. Maybe their last baby was very small or something like that. And they would have a lot of their care at the hospital with one of the obstetric consultant doctors. Now, they may have only 1 or 2 appointments with the consultant and then see the midwife for the rest of their appointments, but for some women they will have all their appointments with the consultant at the hospital. It depends on the situation, and the consultant would make a personal care plan for you if that was necessary. If you are having most of your appointments at the hospital with the doctors, then you can of course always come and see the community midwives as well, just for the support that the community midwives can give you. For these women, it's usually advisable to give birth on the labour ward, unless the doctors decide that actually we monitored you through your pregnancy, everything's fine, and you can go back to the community midwives for giving birth. But that would be a discussion to have with the doctor, and we would recommend that you accept their recommendation. A department at the hospital that you will almost certainly visit during your pregnancy is the antenatal assessment unit. It's next door to scan, and you've probably already been there for the blood test that goes with the 12-week scan. Another job they do is monitoring of mums and babies' well-being. Some women, if they have a problem like high blood pressure or diabetes, or there's concerns about baby's growth, may visit them quite a lot towards the end of their pregnancy. But any mum, if she's concerned about her baby's movements, so the movements are less than they usually are, then this is the place to call during office hours. They also can do your pregnancy vaccinations, which are whooping cough and flu, and I'll tell you a bit more about those later. And they also do some blood tests, such as the 28-week glucose tolerance test that some women need to check that they aren't developing diabetes. They're open Monday to Friday, 8 till 6, and their phone number is at the bottom of the slide. The labour ward is another department that a lot of women will visit during pregnancy or to give birth. It's a birth environment for women with more complicated pregnancies or that have been allocated as being high risk. They're also a really important point of contact if you have any worries at all about your health or the health of your baby during your pregnancy. So maybe if your baby's movements have stopped or reduced and the antenatal assessment unit aren't open, they're the people to call.
Welcome to the Warwick Hospital Maternity Unit. We know having a baby is an exciting time, but there's a lot to take in, so this video aims to show you how to find us and what you can expect when you get here. Warwick Hospital is located on Lakin Road near the centre of Warwick, so benefits from good transport links, and we also have an on-site car park. If parking on site, simply take a ticket and keep it safe so you can pay before you leave. There are signs showing where the pay machines are, and also signs showing you how to find us. We recommend walking down the passageway to the right of the A&E department, through the blue automatic doors under the canopy and along the corridor. We're on the first floor, so you can either take the lift or the stairs. Further signs will direct you to each individual area, and guidelines are displayed outside every ward. Please take note of these. Upon arriving, please introduce yourself to a member of staff who will be happy to help. Our modern unit offers a comfortable waiting area and a relaxed environment. We offer a variety of different birthing options, so our specialist maternity staff can help you find what's best for you and your new baby. currently deliver around 3,000 babies a year, so choosing Warwick Hospital means you're in safe hands as you welcome the latest member of your family. Thank you for watching, and please contact us using the details below if you'd like to know more.
The Bluebell Birth Centre is another department at the hospital. So this is a birth environment for women with low-risk, uncomplicated pregnancies who are at least 37 weeks pregnant and don't need to be induced. If you give birth here, it's really important to understand that there are only midwives on duty here, and if you have any complications, you would be recommended to give birth in labour ward, or if they happened during your labour, then you'd be transferred upstairs to the labour ward. The community midwives are based at the Bluebell Birth Centre, and they do some of their antenatal and postnatal appointments there. Swan ward is the antenatal and postnatal ward at the hospital. So that means it's the ward for mums and babies to stay after birth, or if women need to stay in hospital before they have their babies, they'd be on Swan ward. Inductions of labour also start out on Swan ward before you get into active labour. Induction of labour is when your labour is started off artificially because you're overdue or because there's a problem with your pregnancy. If you ever need to contact us, you always can. There's always a midwife available to talk to you. During office hours, you could try and ring your community midwife's mobile phone. But if that's off, it means she's not working. So if you leave her a message, it may be some time before she gets back to you. This is something to bear in mind if you send her a text, and then you won't know if her phone's off. So please never text or ring your community midwife about an urgent problem. Maybe your baby's reduced movements or you've got a terrible headache. Please always call the hospital about those things and speak to somebody. You can ring the Bluebell Birth Centre if you think you're in labour and you're planning to give birth there and you're over 37 weeks pregnant. Or if you can't get hold of your community midwife and you want to talk to a community midwife. You can ring the antenatal assessment unit in office hours about any change in your baby's pattern of movements or any physical problems that you're worried about. And you can ring labour ward at any time, 24 hours a day. They're always there about any change in your baby's pattern of movements, if you think you're in labour, or just anything that you're worried about. Maybe a bad headache, strange itching, pain in your tummy, anything at all. Please always feel that we're available and we're happy to talk to you. Never be shy of talking to us. We're always there for you. Things that really are important that you tell us about. I've mentioned this one a few times. Any change in your baby's pattern of movements, especially a reduction. Any pain in your tummy, especially if it's severe or coming and going, or if it's just really bad and doesn't go away. Any headaches, especially with visual disturbances. Now, in early pregnancies, around this time, around 16 weeks, you can get headaches quite commonly, and we're not quite so worried about those. Take paracetamol, drink plenty and get plenty of rest. But later in your pregnancy, any bad headaches, we want to check you haven't got high blood pressure. So any bad headache behind your eyes, especially with visual disturbances, give us a call. Any vaginal bleeding at all we want to know about, or if you get a big gush of watery fluid from your vagina and you think your waters might have broken or you're just not sure, give us a call about that. Sometimes your waters can go with a big gush and it's very obvious. Also, they can go with just a trickle, so it's much more hard to tell. So if you ever think, was that my waters, give us a call. Itching, especially of your hands and feet that doesn't go away, and just anything that you're worried about. As I've already said, you're probably getting bored of this now. We're always there for you. Please call us if you're ever worried about anything at all. For many people, pregnancy is a very happy time, full of excitement and anticipation. But for some, it's really stressful and frightening, leaving them feeling anxious, depressed or out of control, out of their comfort zone. In any year, 1 in 4 of us will experience a mental health problem, and that's without adding pregnancy into the mix. This can feel really frightening or even something to be ashamed of, but it's just part of the normal range of being a human being. Bottling up difficult feelings that you are having can make them worse, make them grow, so it's really important to talk about them and ask for help. Acknowledging problems often makes them easier to deal with and helps break the stigma of mental health problems. The next slide has a video about mental health problems that can affect mums or dads during pregnancy or after having a baby. It can be a bit of a tough watch, but it has lots of information on looking after yourself and each other and help available. So give it a go. I hope you found that video useful. If it's raised any issues for you or you feel you need to talk, please don't hesitate to contact your midwife or another midwife through the Bluebell Birth Centre. Your midwife will already have talked to you about this, and hopefully you don't smoke or drink now. If you are still smoking, it's very important that you stop. There's a high risk of miscarriage and stillbirth. Stillbirth is when your baby dies in your womb. Your baby being born prematurely or being very small. Smoking affects the way that blood moves through your placenta, and your placenta is what keeps your baby alive. So just by smoking, you'll impact on your placenta and therefore put your baby at risk. If you still smoke after you've given birth, then your baby is at a much higher risk of cot death. Drinking alcohol in pregnancy carries all those risks as well, but there's an added risk with drinking alcohol in pregnancy called fetal alcohol syndrome, and that's when babies are born with learning difficulties and behavioural problems. We don't know how much alcohol a mum needs to drink to put her baby at risk of fetal alcohol syndrome, so the recommendation is not to drink any alcohol at all. We also recommend that you don't drink too much caffeine. We say no more than 200 milligrams of caffeine in 24 hours. A cup of tea is thought to have about 70 milligrams of caffeine, a cup of instant coffee about 100, a cup of strong coffee shop type coffee about 200. And remember that there's caffeine in chocolate and lots of fizzy drinks, so don't have too many of those either. We recommend 2 vaccinations during pregnancy. The first one is for flu, and that's because flu in pregnancy makes you much more sick than if you're not pregnant. And if you're sick, then your baby's going to be sick. The second one is for whooping cough, and that's to protect your baby, so that when your baby is born, he or she is already immune and protected until they can have their own vaccination when they're 2 to 3 months old. It's like giving your baby their first vaccination via your arm. You could get these vaccinations either at the antenatal assessment unit or from your GP surgery. Taking exercise in pregnancy is really important. It helps keep you strong and physically fit, and that makes labour easier. Also, it helps control the amount of weight you'll gain, reduces your chances of having a problem with your blood pressure or diabetes, helps you sleep, and it's really helpful with mood. So if you're feeling stressed or anxious, taking some exercise can really help. The goal should be about 150 minutes of moderate intensity activity every week. That's not too much every day if you divide it by 7. If you're already very physically active, carry on with what you're already doing. Like the lady in the picture here, she would have been a runner before she got pregnant, and she's just carried on running through her pregnancy. If you're not a runner, nobody expects you to become a runner in pregnancy, and it wouldn't be a good idea. But it is a good idea to start slowly with something like a walk every day, using the stairs rather than the lift, going to a pregnancy yoga or Pilates class or swimming class called Aquanator. Dancing around the living room is as good as anything. If you've already got children, playing actively with them is really good too. You should avoid exercise where there's a risk of a bump to your bump or a blow to your tummy. And listen to your body and adapt. So if your body says stop, this is too much, then stop. Every activity counts, and a little bit is better than nothing. It's also really important that you do pelvic floor exercises. Your pelvic floor are the muscles between your legs that stop you from wetting yourself. To exercise these muscles, try and squeeze them as though you're trying to stop yourself in the middle of a wee, but don't do it in the middle of a wee. Aim to do this about 10 times, 3 times a day. Squeeze for the count of 10, relax for the count of 10, 10 times, 3 times a day. On the next slide, there's a link to a video with a bit more information about pelvic floor exercises, so have a look at that. The message around foods to avoid in pregnancy is quite complicated, so I really recommend that you follow the link on the slide. That's to the NHS website on foods to avoid in pregnancy. In brief, you should avoid soft cheeses like brie and camembert because they can contain listeria. However, if you cook them thoroughly, they're okay. Same goes for blue-veined cheeses like Stilton. Hard cheeses are all fine. Eggs that aren't lion stamped should be thoroughly cooked so that they are hard all the way through. That includes the yolk. Avoid pâté because it can contain listeria. That includes vegetable pâtés. Make sure any meat that you eat is thoroughly cooked, so no more rare steaks, I'm afraid. Cold cured meats like salami, be careful of. If you freeze them, they're fine, or if you cook them, they're fine. Avoid anything with liver or offal in it, and avoid game because that can be shot with lead pellets, and the lead can be bad for your pregnancy. Some fish should be avoided altogether. That's shark, swordfish and marlin. Tuna, don't eat more than 2 tuna steaks a week or 4 medium-sized cans of tuna a week. Shellfish is fine if it's cooked. Smoked fish is fine. Sushi is okay so long as the fish used to make it has been frozen. Ask the place that you buy it from. Peanuts are fine unless you have an allergy. Any milk or dairy products should be pasteurised. Ice cream is fine, including soft ice cream. Any foods that you eat raw, any fruit or vegetables that you eat raw, make sure that you wash them before you eat them. There's no need to eat for 2 when you're pregnant. It's really easy to put on a lot of weight when you're pregnant and very hard to shift it afterwards. By the end of your pregnancy, you will need about 200 calories more a day than you needed before you were pregnant. Up until about 30 weeks, you probably don't need any more calories a day. You may be very hungry during pregnancy. That's really common. Try and snack on fruit and vegetables. So an apple, a satsuma, carrot sticks, that kind of thing. Make sure you get your 5 fruit and veg a day. Base your meals on carbohydrates or starchy foods, things like pasta or rice or potatoes. And go for the wholemeal versions, or don't peel your potatoes, and that will make sure you get lots of fibre in your diet. Make sure you get plenty of protein. That's meat or beans, pulses or dairy. And limit the amount of sugary and fatty foods you have during pregnancy. So a little bit of cake is okay, but not too much, and try and avoid too many chips and that kind of thing. Make sure you take vitamin D all the way through your pregnancy. You'll notice through your pregnancy how often your midwife asks about your baby's movements. Your baby will start moving anything between 16 and 24 weeks of your pregnancy. It will start out very subtly and very light. It will feel like flutters or butterflies in your tummy. It's different for every pregnancy, so your baby's movements won't be the same as your friend's baby's movements or the same as your last baby's movements. Every baby is different because they're different people. Try and think of your baby's movements as your baby saying, "Hi mummy, I'm fine." So if he stops saying he's fine in his normal way, then maybe there's a problem that we need to check out. So try and tune into your baby's movements so you develop a sense of what's normal for your baby, so that you notice if he changes from his normal pattern. We are especially worried about a reduction in your baby's movements, or especially if your baby stops moving. But we're also concerned about a significant increase in movements. So any change at all in your baby's pattern of movements, please ring the hospital, either the antenatal assessment unit or the labour ward, and they will do some monitoring of your baby to check that he is well. Please never be tempted to buy yourself a home Doppler. That's a machine that you can use to listen to your baby's heartbeat. Midwives are trained to use these machines and to assess your baby's heartbeat for problems in a way that you are not. So you might think, "Oh, I'm a bit worried about my baby's movements," and listen and think, "Oh, that's fine." But actually you might not hear a problem that is actually there, or you might pick up your own heartbeat when you think you're listening to your baby. So if you're ever worried about your baby's movements, please ring the hospital. Any time, day or night, we're always there. Please always ring us with any concerns about your baby's movements at all, any change in pattern. We always want to hear from you. We're never too busy for you. We'll never think you're making a fuss. We always want to hear about it. Building a relationship and connection with your baby from early in your pregnancy is valuable. Your baby can hear your voice through your tummy from, we think, about 16 weeks of your pregnancy, and will recognise your voice after they are born. Try and take some time out of your busy day to focus on your baby. This will often make you feel calm and relaxed, and that will increase your levels of a hormone called oxytocin. Oxytocin is known as the love hormone, and in babies it is important for brain development. When a mum has a surge of oxytocin, it passes through the placenta to the baby, and that helps the baby's brain develop. When you feel your baby move, try and respond to the movements. Say hello, have a little chat. Other people will be able to feel the baby move through your tummy from about 28 weeks of your pregnancy, so it's great if you can include your partner or older children in this.
When you're ready, let your eyes gently close and start to focus on your breathing. breathing easily and comfortably. Noticing the air coming in through your nose and out through your nose or mouth. Just letting your breath come and go as it naturally does. Breathing in and breathing out without trying to change anything. Maybe noticing where in your body you feel your breath the most. Perhaps in your nose or your throat, or your chest or your belly. Just keeping as much of your focus as you can on your breath. And if your mind starts to wander, as it will, acknowledge those thoughts and then gently bring your focus back to your breathing, allowing any sounds around you to help you feel safe, allowing those sounds to help you relax a little more. Now take a couple of deep breaths, slowly filling your lungs with fresh air, and as you slowly exhale, you relax more and more. With each breath, relaxing more and more. Imagine you can breathe in peace and calm. Imagine you breathe out tension and worries. Breathing in peace and calm. Breathing out tension. Just letting your breath come and go naturally. Maybe noticing the way your abdomen gently rises as you take a breath in and deflates with each out breath. Abdomen gently rising as you take a breath in, and as you exhale, imagine the breath drifting down through your body, down through your legs and out through your feet. As you exhale, you direct your breath all the way down through your body, down through your legs and out through your feet. With each out breath, relaxing more into the chair, allowing your body to feel a little heavier. And now, maybe noticing the slight pauses between an in-breath and the following out-breath. between an out breath and the following in breath. Just being aware of those slight pauses. Or if you prefer, focus on a place in your body where you find the sensations of breath most vivid and distinct. Allow each breath to relax you more and more. As you continue to breathe in peace and calm, and to breathe out tension from your body. Softening the muscles in your face, relaxing your shoulders. Allow your shoulders to drift down into the rest of your body. And if your mind begins to wander, acknowledging those thoughts and gently bringing your focus back to your breathing. Breathing easily and comfortably. Now, in a moment, it's going to be time to finish this relaxation. So start to focus more on your in-breath and imagine drawing energy into your body. Starting to become more aware of the sounds around you. Moving your legs and feet. Moving arms and hands. And when you're ready, opening your eyes to feel awake and refreshed.
I hope you have found this presentation useful. If you have any questions at all, please contact your midwife or the maternity unit at Warwick. We hope to recommence the Full Path to Parenthood programme as soon as possible, and I do hope you understand why we felt that we've had to cancel it for the time being. Good luck!